I was shocked to learn that my local GP, that's general practitioner at the medical centre in my very much rural area of Yorkshire, earns £86,000 a year. That's a colossal amount of money in that area, trust me, where the average salary, a good salary would be around about £42,000. So you understand how this particular story is going to engulf. Now what's interesting over here is for the first time allegedly in 60 years, GPs, general practitioners, have decided that they're going to work to rule. It's not a strike, no, it's not a strike, it's a work to rule. And this is because they've now decided that they're going to be cutting down to around 25 patients to see per day. Right, 25 patients a day, because apparently they need more time, and if they could get more money from the government, this is the brand new Labour Party government, then they could employ more people to see us. Now I don't know about you, I've not been able to see my doctor for years. In fact, I wouldn't know what he looked like. I just looked up his salary in the public domain, which is online. You can do it yourself if you want to know exactly how much your GP is earning and what they spend the money on. My health centre spends wasted money on woke inclusiveness training. Yes, every Tuesday. And then of course on top of that they've got the panels to save the planet on top of the roof, all coming out of course of that expenditure. You see what it's like. Very soon they want to charge people to park their cars while they're going for said appointments if they're lucky enough to get one. But here's my argument, and this is the bigger problem that's really engulfing the health service over here, now looked after by the Health Secretary, Wes Streeting, who apparently is going to be wiping away all of the waiting lists. Nobody's seen anything yet. Apparently he thought it had happened last week, but it's when all the computers went down and everything went to nothing, then it popped back up and it was even longer. You get the picture. But look at this, you see. All of these people that claim they are overworked, these GPs, and I'm sure there are very good-hearted ones, but so many of these people appear virtually every single day on your TV. In fact, one of them is on TV virtually daily. And what I find fascinating is when he's not doing that, he's also offering voiceover work, he's written a children's book, and then on top of that, he appears on other programs with some other kind of medical advice. So if they're so busy, so strapped and really overworked, how on earth can this particular individual claim that they don't have time to see patients? Now, I don't know if you realize this, but these particular companies also make a lot of money by inviting in TV cameras. Anybody seen programs like GPs Behind Closed Doors? Well, the TV companies pay thousands of pounds basically to the medical centre, not to the patients, because they sign non-disclosure forms, meaning they don't get paid to appear on camera. It's just the medical centre that picks up the thousands of pounds. And there are so many of these programs currently being made over here in the United Kingdom, along of course with all the money being crafted in from the endless hospital programs too. So to say that these particular individual companies are cash strapped, and to say that these GPs are vastly overworked, truly think again. I mean, TV stars, or appearing in panto or musicals like Dr. Raj. You understand how this works now. Use the title, use your expertise at the expense of the NHS, and then go off and get the career that you truly craved. Why don't these TV doctors sling their oak and actually let people in who actually want to be medical practitioners? I'd love to know what you think to this particular story, and is it like that in your part of the world too? Neil Sean in the very heart of London.